There is a deficiency so common that neurologists call it an epidemic. It damages your nervous system. It destroys your memory. It paralyzes your legs. And it does this so slowly that most people do not realize what is happening until the damage is permanent. It is not rare. It is not expensive to fix. And the test costs almost nothing. Today I am revealing 7 warning signs your body is dangerously low on vitamin B12. And sign number 5 will genuinely disturb you. Stay until the end. Unlike vitamin D, which your skin produces from sunlight, your body cannot make B12 on its own. Every microgram must come from food or supplements. And B12 requires a specific protein from your stomach just to be absorbed. Over 6% of adults under 60 and nearly 20% over 60 are deficient right now. These are the 7 signs their bodies are sending. Signs completely different from any other deficiency because B12 holds your nervous system together. Sign number 1. The first sign sends most people to neurologists before anyone checks a simple blood test. Tingling, numbness, or pins and needles traveling up your legs, sometimes in your hands, coming and going unpredictably. Vitamin B12 is essential for producing myelin, the protective sheath surrounding every nerve fiber. When B12 is deficient, myelin production slows and begins to degrade. Nerve signals become scrambled or blocked entirely, and your brain interprets that as tingling, numbness, or burning. This is not carpal tunnel. This is your nervous system losing its insulation fiber by fiber. Left untreated, this progresses to permanent paralysis. Caught early, completely reversible. But sign number 2 is happening inside your blood, invisible until it suddenly is not. Sign number 2. Extreme shortness of breath during light activities. Walking upstairs, carrying groceries. Vitamin B12 is critical for producing healthy red blood cells. Without it, your bone marrow produces cells that are abnormally large and misshapen, called megaloblasts. These cells cannot carry oxygen efficiently and die far sooner than they should. The result is megaloblastic anemia. Your organs receive less oxygen. Your heart works harder to compensate, producing breathlessness during activities that should be effortless. Most doctors test for iron deficiency first. Many never check B12. If breathlessness has not responded to iron, insist your doctor check B12 immediately. And sign 3 will surprise you because it happens somewhere most people never think to look. Sign number 3. A smooth, swollen, or inflamed tongue combined with mouth sores at the corners that return repeatedly despite treatment. Your mouth has some of the fastest dividing cells in your body, completely replaced every few days. This requires enormous amounts of B12. When deficient, this renewal breaks down. The tiny bumps on your tongue disappear. It becomes unusually smooth and shiny. It may swell or hurt with hot food. Ulcers form repeatedly at your mouth corners. Most people treat this with creams or vitamin C for months before connecting it to B12. And now sign 4. Affecting millions of Americans, and almost nobody knows why. Sign number 4. Depression, anxiety, or a creeping emotional numbness with no clear life explanation. B12 plays a direct role in producing serotonin, dopamine, and norepinephrine, the chemicals regulating your mood and emotional resilience. B12 is required for methylation, the pathway your brain uses to convert amino acids into these neurotransmitters. When B12 is deficient, production drops, and your mental landscape shifts in ways unrelated to your life circumstances. Research shows significantly higher B12 deficiency rates in people with depression and anxiety disorders. Multiple studies show correcting deficiency produces measurable mood improvement, sometimes within weeks. If depression or anxiety has not responded to treatment, ask specifically for a B12 test. But sign number 5, the one I told you would disturb you, here it is. Sign number 5, memory loss and cognitive decline in people under 50. Not ordinary forgetfulness. Genuine difficulty remembering yesterday's conversations. Losing track of thoughts mid-sentence. A feeling that your mental sharpness is slipping away. Your brain requires B12 for myelin maintenance and homocysteine metabolism. When deficient, homocysteine, a toxic amino acid, builds up. Elevated homocysteine is directly toxic to brain cells, damages blood vessels, and accelerates brain atrophy, the physical shrinking of brain tissue. A landmark Oxford University study found B12 supplementation slowed brain atrophy by 90% compared to placebo. 90%. If you are under 50 and noticing cognitive changes, get your B12 checked today. And sign 6 will surprise you because most people think it is just an eye problem. Sign number 6, blurred or shifting vision, sometimes seeing double, that comes and goes and does not respond to glasses. Your optic nerve requires myelin to function accurately. When B12 deficiency causes myelin degradation in this nerve, visual signals become distorted. This is called optic neuropathy, and like nerve damage elsewhere, it is reversible if caught early. If your vision changes cannot be explained, and you have any other sign on this list, insist on a B12 test. And finally, sign number 7, the one most people experience every morning and never take seriously. Sign number 7, extreme difficulty getting out of bed combined with heaviness and weakness in your muscles, particularly your legs, that persists no matter how much you rest. This reflects both the anemia and neurological effects of B12 deficiency simultaneously. Oxygen-starved muscles cannot contract efficiently. Weakening motor neurons send unreliable signals. You feel like you are moving through water. Getting off the couch requires more effort than it should. This combination is one of the clearest signals that B12 supplementation is urgently needed. Bonus: if you recognize any of these signs, ask your doctor for a serum B12 test combined with a methylmalonic acid test, which is far more sensitive and catches deficiency even when B12 looks borderline normal. The best food sources are beef liver, clams, sardines, salmon, eggs, and dairy. If you are vegetarian or vegan, supplementation is essential. Look for methylcobalamin, the most bioavailable form. If you are over 50 or have digestive issues, sublingual B12 or injections bypass absorption problems entirely. Vitamin B12 deficiency is reversible, but only if you catch it before nerve damage becomes permanent. 7 signs: tingling and numbness, unusual breathlessness, smooth tongue and mouth sores, depression and mood changes, memory loss, disturbed vision, and profound muscle weakness. If you recognize even one, get tested this week. Hit the like button if this helped you. Subscribe to Health Decoded for weekly videos that give you the real truth about your health. Comment below, which of these 7 signs hit closest to home? Your nervous system is depending on you to take this seriously. I will see you in the next one.